And the notion that this will be cheaper, I'm reminded of what the humorous P.J. O'Rourke said. If you think health care is expensive now, wait till it's free.
Although it's pretty expensive now.
It is.
And there are issues like rationing that the Republicans bring up that goes on now when private insurance companies say you can't have certain things covered. That already exists.
Not like it would if you had a government plan. I had a friend of mine in Florida who called up recently and said he just lost a friend of his in Canada because the government decided he was too old for a certain kind of procedure, and apparently he didn't have the money or the ability to get down to the United States for quality health care.
Millions more are underinsured, unable to pay their deductibles or get access to dental care. Recently, we heard about an American relief organization that airdrops doctors and medicine into the jungles of the Amazon. It's called Remote Area Medical, or RAM for short. Remote Area Medical sets up emergency clinics where the needs are greatest. But these days, that's not the Amazon. This charity, founded to help people who can't reach medical care, now finds itself throwing America a lifeline. Most of the people who filled the lot heard about the clinic on the news or by word of mouth, and they came by the hundreds.
Meanwhile, back at home, hospitals had found a new way to deal with patients who didn't have health insurance and couldn't pay their bill.
I was standing up against the wall and I saw a cab do a U-turn and pull up to the curb, and I watched to see what was happening because I had a feeling what was going to occur because it's not a new thing.
They pulled up right here by this yellow fire hydrant and dropped Carol off and immediately pulled away. And as soon as they pulled away, she walked out into the street about out to here.
A sad death in New York City. Surveillance cameras at a city-run psychiatric hospital emergency room in Brooklyn capture a woman falling from a chair, writhing on the floor, and dying. Hospital staff and other patients watch and do nothing for more than an hour. One guard doesn't even leave his chair, rolling it around the corner to stare at the body.
When Secretary Sebelius says that there will be more competition if you have a government-run insurance company, there will be no competition. The government will, with the backstop of the taxpayers, undercut the 1,300 or so health insurance companies we have. We won't have any competition at all. Pretty soon the doctors and the hospitals will all be working for the government.
And probably the biggest disagreement of how you get there is whether the government is going to run a plan that doesn't broaden competition, but actually eventually eliminates.
Well, you know, it's interesting, and I'll let you maybe discuss this with my colleague Sanjay Gupta, who's been giving this a lot of thought.
The public option would be for, the way it's been presented would be for people who cannot afford health care, need some sort of subsidy, need some sort of other system in which they can purchase into to get their health care insurance. The concern, the critics will charge this, Rick. They will charge that a public option that has the backing of taxpayer dollars will be such a big competitor that we eventually sort of remove the private insurance industry altogether, and that won't be any kind of competition at all.